Hello, today we have Dr. Alim Akhtar Bhuiyan with us. Uh, he is currently working in Evergreen Hospitals, Dhaka, previously known as Apollo Hospitals, Dhaka. It is the only JCI accredited hospital in Bangladesh. He is working as senior consultant and coordinator neurology. Dr. Bhuiyan obtained American board certification in neurology and postdoctoral fellowship in neurology. He previously worked in Bangladesh Medical College as a senior faculty and consultant neurologist in VA Hospital in Syracuse, New York, USA. Today he'll be discussing about autism, which is a very important neurological disease. What,
Thank you, Tanvir, for the nice introduction.
what do you mean by autism?
Autism or autism spectrum disorder is a very important neurological disease which is found in children, and these patients they grow with this disease. It is actually a neurodevelopmental disorder, and these patients have problem in several domains. One is they have problem with social interaction. Number two, they have problem with verbal and non-verbal communication. Number three is they have repetitive behavior or interest.
What are the symptoms and signs of autism?
Autism signs symptoms are different. First, we have to know the different milestone what a child develops as he ages. So, normally, a baby when he is 1 year should uh, make babbling sound or cooing, and by 18 months he should have one word uh, pronunciation, and by 2 years he should be able to make two words. So if these are delayed, then we think the patient has some problem with language. So social development is a problem. These patients they have uh, less attention to social stimuli, smile and looks at others less often, and they respond less to their own name. And the toddlers with autism they make less eye contact. They do not have the ability to use simple movements to express themselves, such as pointing at things, and they perform worse on tests of face and emotion recognition. And these patients suffer from intense and frequent loneliness when they are child, and they prefer to be alone, and making friendship or making friendship and maintaining it is a problem with children with autism. And they have problem with repetitive behavior. It starts at the age of 6 months, and they continue throughout the adulthood. And these patients repetitive behavior or restrictive behavior can be in different fields. uh, Number one is stereotypy, is repetitive movements such as hand flapping. They can have head rolling or body rocking. They can have compulsive behavior such as arranging objects in stacks or lines. They can also have self-injury behavior. They can injure or can injure the person as eye poking, hand biting, or head banging. They can also have restrictive behavior, uh, is limited to focus, interest, or activity, and they have preoccupation with a single television program, toy, or game. So these patients, one third to half of them, they have problems with communication and do not develop the natural speech, and they less likely they are less likely to make requests or share experience. And so these are the few features these patients have, and they can have other problems like behavioral problem, sleep disturbance, eating becomes a problem, they overeat or take less food. And 25% of the patients with autism, they can have epilepsy, and they have GI symptoms like abdominal bloating, chronic diarrhea, intolerance to certain kind of food. And so these patients a lot of times develop deficiency states of vitamin D or minerals.
Who are affected by autism and what are the causes of it?
Autism actually uh, can be detected by the age of 3 years, but the symptoms can be found early, and a lot of times the parents, they become aware of atypical behavior of their infants at early age. But most of the autism features are diagnosed 5 to 7 years of age, and it is 3 to 2 times more common in males than females, and uh, it affects one out of 110 children are affected by autism. And what are the reasons? Actually, there are no clear-cut reason why patients have autism, but there are several theories uh, which account for autism. Number one is environmental factor. There is another cause, could be genetic factors. Actually, no specific gene has been found to be responsible, and this child born with autism, the next child of the parents, in most cases, might not develop autism. And there are also agents that cause birth defects, and but the causes could be multifactorial, and no specific cause can be. We are not sure always about this specific cause.
What are the different types of autism spectrum disorders or ASD?
Autism spectrum disorder can be of different types. Sometimes it is very difficult to differentiate between the different types. Most important we find is Asperger's syndrome, which is a high functioning autistic disorder, and there is pervasive developmental disorder not otherwise specified. This is the one where patients don't show the typical symptoms of autism. It can be mostly found in earlier age. And there is another one called childhood disintegrative disorder.
What are the strengths and weaknesses of patients with autism?
As I mentioned earlier, there are a lot of problems with patients with autism. The problem is they have problem with social interaction, they have problem with language, so they cannot understand, they cannot express. Lot of them, they can develop mental retardation over time. Actually, 75% of the patients with autism, they develop different types of mental retardation, mild to severe, and only 25% have high intellectual function. Even it can be very significant. This strength, these patients, some of the patients, they have particular interest or strength, like in music or painting or mathematics and so forth. So lot of strength and some weakness are there. These children have different capabilities.
Is there any chance of transmission of autism in families?
The chance of autism running in families is extremely low. So a child with autism born in a family, the next child of the parents will not develop autism, and because it is a single gene disease, no specific gene has been responsible for transmission of the disease, so very unlikely of transmission of this disease in families.
How do you diagnose autism?
As I mentioned, the diagnosis of autism is based on clinical features. Actually, the odd behavior and the language problem and social interactions and other features, these are the symptoms which are first noticed by the parents, and so they bring these children to their pediatrician, and then it is slowly diagnosed over time, and lot of these problems can be found by the school teacher when they are in preschool. So on average, the diagnosis of autism happens between 5 to 7 years of age, but most of these children, they show the symptoms by age of 3. So there is no actually any specific test to diagnose autism, and if we do the MRI of the brain or CT scan of the brain, we don't find any structural lesion as such, unless there is some other comorbid condition, but it can be done sometime. And as I mentioned, 25% patients with autism can have epilepsy. If patient has epilepsy, we can do EEG. Sometimes genetic testing can be done to see any specific gene responsible, and sometimes the metabolic workup can be done or endocrine workup can be done to see whether patient having any causes of autism. Most of the autism are primary autism. That means in spite of all the workup, we don't find any reason. But there are some secondary autism where we can find some reason. Like patients can have congenital abnormalities of the brain, like lyssencephaly, porencephaly, schizencephaly, mesencephaly, or patient can have neurocutaneous disorders like tuberous sclerosis. So in those cases, we can do some investigation, and sometimes we have to do audiology testing, hearing testing, to make sure patient is hearing okay. And these patients also should be assessed by a child developmental center to see what is their status, and there are different type of monitoring and screening tests to assess their standard and whether definitely they have autism, and these patients should be monitored from time to time.
Is there any role of diet on autism?
As I mentioned, the lot of patients with autism, they have GI symptoms. They don't eat enough, or they eat too much, and certain food they cannot tolerate. So they have intolerance to gluten, which is found in fat, and casein, which is found in milk. So milk products and wheat should be avoided in these patients. Sometimes caffeine products can enhance their hyperactivity, uh, and also some nuts. So that should be avoided. Some of the food which can cause um, allergy or intolerance should be avoided, and we have to try different type of food to see what the patient cannot tolerate. In this way, a lot of these patients runs vitamin D and minerals deficiency. So this should be given from time to time. There is some role of coenzyme Q, which helps in the improvement of behavior, but it is not a proven treatment.
What is the outcome or prognosis of autism?
The different types of autism carries different outcome or prognosis. There are some autistic children, high functioning autism like Asperger's syndrome. They can be doing well in their career. Even there are people with autism who are successful in their career. They have become professors, they are doctors, PhD degree holders. But if you look into their lifestyle, they have certain bizarre or odd behavior which is characteristic of autistic symptom. That is, they have mild autism. And as I mentioned earlier, 75% of the patients with autism, they have mental retardation. So starting from mild to severe. So a lot of the patients with autism, they need total care. They need lot of help for their life. So they need help with eating, grooming, bathing, dressing, and day-to-day life. So depends on the extent of the disease, and we can assess their IQ from time to time, what is their level of functioning.
Tell us regarding the management of autism.
Actually, the diagnosis of autism is difficult and sometimes challenging. Once it is diagnosed, there is no cure for the disease. There is no specific treatment which will cure the disease. So, as patients have problems in different domains, it should be addressed. So, these patients can have multi functional treatment. So, they can have, the idea is to increase the quality of their life and functional independence. And there are different treatment available like applied behavior analysis, ABA, developmental milestone, structured teaching, speech and language therapy, social skill therapy, and occupational therapy. And this patient should be in a special school where they get different types of treatment, as I mentioned earlier. And for symptomatic treatment of the problems their patient is having, there are some medicine. So if patient is having behavioral problem, there are two FDA approved drug. One is the risperidone, another is ariprazole. And patient if having some problem with sleep, some sedatives can be used, but not as much. If patient has epilepsy, that can be treated with proper anticonvulsant drug. And if patient is having GI symptoms, that should be evaluated and treated with certain medication and dietary modification. So the issue is to treat the problems patient is having. So most important part of the treatment is they should be in a special structure at home and also in a school setting. And over time, these patients can improve their behavior, socialization, and improvement in their aggression and other symptom. So these patients are special child with special needs. So they should be integrated in our society, and there are a lot of services which are being available all over the world, including Bangladesh, which are offering different kind of services. Thank you for your kind attention. Thank you.